So we're going to go over a really interesting acupuncture point because it's quite distal from where it actually affects. We're going to small intestine 6, and this is for acute pain, especially in the shoulder and the upper arm. So let's show you some particulars of this particular one. So what we're going to do is we're going to turn the palm over, the dorsal aspect of the hand, and then we're going to go on the ulnar side. And we're going to basically just move right the head of the ulna up from that point. So just slightly up from it. It's going to be right there, right on the bone there. You feel that, Mickey?
Mm-hmm.
Okay. And as I mentioned, this is particularly effective for treating acute pain and stiffness in the shoulder and the upper arm. And it's interesting because they also use this for neck stiffness. And you may be asking, how can they possibly treat neck stiffness with this point? Well, in the extremities where there are acupuncture points, there are thickenings of the fascia or connective tissue. And those areas have increased neurological receptors, about 10 times more receptors than muscles or ligaments or other tissues. Feeling that right there?
Mm-hmm.
Yeah, right there. It's interesting because we're using this specifically for musculoskeletal conditions, but in traditional Chinese medicine, they would also use this to treat eye problems, blurred vision, and even night blindness. And if you want to do some research on that, just go to some of the, you can even actually go on ChatGPT and they'll probably tell you a lot about it. But it is interesting how they use it for a wide variety of conditions. We specifically only use it for treating musculoskeletal conditions. Now, contraindications, this should be avoided in individuals' severe shoulder injuries or even infections. So again, you stimulate this point for about 30 seconds to 3 minutes. That's actually eased up quite a bit, hasn't it?
A lot.
Yeah. Very powerful point. Small intestine 6.